The role of the Community Care Committee is to connect the dots between the branches of our medical practice and the joins between primary, secondary, and social care. We monitor policy and trends, pinpoint unmet care needs, and promote new and novel approaches. COVID 19, as it has spread across the world, the UK, and into our communities, has brought our role to the fore. It has trained a national media floodlight on many of the long standing issues we have been raising tirelessly again and again. Public funding, which falls woefully short of what is needed for the services we want and that our patients rightly deserve. The long standing issue of chronic staff shortages, an underpaid workforce whose morale has been deflated by years of austerity, yet who are now cast rightly as heroes for the frontline role they have and continue to play. Basic respect and a living wage for all involved in community care is just another issue at the core of our committee's interest. Our committee has called for adequate protection for all health and social care staff. Carers specifically must be provided with the right standard of personal protective equipment. In many cases, they have not. The CCC has worked with other committees to raise concerns about the pandemic's disproportionate impact on staff and patients of Black, Asian, and minority ethnic heritage. It is yet another unacceptable example of the persistent and persuasive inequality in our country and in our service. The long standing need to integrate health and social care to get them working better together is another issue at the core of our work. This has also gained prominence in national debates about COVID when transmission between the hospitals and community settings such as care homes has helped the spread of the virus. The number of deaths in care homes is a stark and disturbing reminder of what is at stake if health and social care continue in their current silos. We have kept a close eye on the financial position of community care. The state of social care was already at crisis point before COVID-19, has been left in an even more untenable position. Social care funders, local authorities have suffered deep financial losses, even as they play a key role on the front line in the effort to halt its spread and support those in isolation. This year, the committee has continued to push for the NHS and social care to work in unison and harmony. We have and will continue to push for the system-wide reshaping we need for a more productive and efficient health and social care service, which is crucially better for our patients. This year, the committee has been particularly focused on the need to reduce care home admittances by helping older people to live independently. Our committee has been taking part in a BMA-wide conversation about the wide-reaching impacts of COVID-19. We have brought the challenges of the adult social care sector and care home to the forefront of all our discussions. We developed a joint statement with the General Practitioners Committee on how to better support adult social care provision during the pandemic. We have been in constant conversation with the BMA's health policy team about the pandemic's feeding in our experiences and helping to shape the BMA's key asks for social care for the post-COVID world. As a committee, we are very concerned about the mental health fallout of COVID-19. Already stretched services will have to cope with the challenges of population which have been impacted directly and indirectly by the pandemic and the economic downturn likely to follow. Our committee is clear that community mental health care must receive adequate resources to deal with people's need. The risk of ignoring patients in psychological need must be recognised. We continue to work with the BMA's mental health policy lead, Dr. Andrew Molodensky, on how we can best support work in this area. and shine a light on these very important issues. Our committee is committed and will continue to push for a fair and balanced transfer of care between primary and secondary care. To this end, we met with Dr. Graham Jackson, Chair of the NHS Clinical Commissioners, a member of NHS England's Primary and Secondary Care Interface Working Group, to speak at our recent February meeting. We raised with him the challenges of working across the acute sector, primary care and community services, and the opportunity for collaboration with BMA colleagues and external stakeholders to improve the interface were discussed. Looking forward, the CCC will demand that services offered in the community are properly funded, that their systems are re-engineered to help doctors and the wide range of other professionals and carers involved to deliver them. Finally, we are yet to face the practical demands of care and caring in the post-COVID-19 world. In these times, the need for a fully funded, integrated service and adequate support for its workforce cannot be overstated. Thank you.